All right, welcome back to the show. It is 8:22 here. I'm Rob Finnerty. Dr. Darshan Shah is with us this morning talking about Google Glass and how it's actually helping doctors during surgery. Dr. Shah, thanks so much for being with us this morning. So tell us about Google Glass. You're wearing them right now. For viewers at home that don't know what this is all about, you're way ahead of the curve here using this during surgical procedures, right?
Yeah, I mean, I love this thing. So I was one of the first adopters of this in the operating room. And, you know, at first I didn't know really how was I going to use this.
Right.
But it turned out to be tremendously helpful. The main thing that I love about this is I can collaborate with other surgeons during a difficult reconstructive procedure.
Right.
So it makes it so, you know, as I was explaining to you earlier, a reconstructive surgery is pretty much a new surgery every single time. There's things that we don't see all the time in reconstructive surgery because every case is new and different. And you know, the benefit of being in a group practice like we are is we have other doctors that we can talk with and collaborate with. However, when you're in the operating room by yourself, you're kind of isolated. Well, this has totally changed that. Now, during surgery, I can call up one of the other physicians. They can see what I'm seeing, and we can talk about what the next steps would be and how to best proceed with the procedure.
I bet you didn't think you'd have this ability when you were in med school. So tell us, what is Google Glass? Like, what are you looking at right now?
Okay, so Google Glass has basically a glass screen right up over here, and what I can see right now is basically a communication screen with Google. So I can lift my head and the glass will be activated, and I can hear the glass talking to me.
Okay.
And I say, okay, glass, and I can look up something. I can video collaborate. I can take a video. I can take a picture.
You can take a picture of yourself on TV right now.
Take a picture of myself on TV. Take a picture.
All right, so what is it actually helping you with during surgery? I mean, I would think it would be maybe distracting.
So the best thing about this, and I thought the same thing when I first started working on it, this is going to be distracting.
Right.
And basically, it is completely out of my field of vision in surgery. So when I'm looking down, I don't even see a Google Glass. But the minute I need help, I can look up to activate the glass, and then I can see a computer screen, basically. And when I'm looking at this computer screen, I can tell it to do different things, to Google any kind of information I need, to talk to other doctors, and then you can literally video conference with other physicians.
So basically, it's like having a cell phone at the ready, you know, like a smartphone right at the ready, at your eyes, whenever you need it.
Exactly, and it totally doesn't get in my way. It's totally non-obtrusive. It's not distracting. In fact, I've gotten so used to it that basically I forget it's even there until I need it.
That's just so fascinating. All right, it does cost about $1,500. So if you at home want to get one of these, it will cost you, and they sell out pretty quickly of the Google Glass, right?
Yeah.
There has been some privacy concerns with these. There was a guy walking around San Francisco filming people, taking pictures. There's been some issues. What do you think about that?
So, you know, that's very important to us in the medical field. We live under what's called HIPAA regulation, where everything that we communicate electronically about patients has to be consented to. So basically, I don't use these glasses anywhere else except for in the operating room. And if I do plan on using it, I have the patients sign that they understand I'm using this for very specific circumstances, just to collaborate, and that's about it.
It is a brave new world, Dr. Shah. Thank you so much for coming in and seeing us today. That's very, very interesting. And they're pretty lightweight, right?
Yes, they're very lightweight. Like I said, you completely forget about having them on. It's great because I can attach these to my operating room glasses that magnify. So I use this just as my regular OR glasses.
Okay. Well, thank you very much for coming in and
welcome.
showing us this new technology here on Eyewitness News. It is